Hello and welcome to this short presentation on coaching skills for practitioners. This is the new NMC standards for student supervision and assessment, otherwise known as the SSSA. This came into effect as of the 1st of September 2019. There are no more mentors, which means no more 40% with one person. We have some new roles. We have the practice coordinator role, which is the ward manager, education lead, or somebody that's been delegated that task by the ward manager. There is the practice assessor, currently those that are mentors and have had mentor training. And then there's the practice supervisor. This role is any registered healthcare professional. That could mean dietitians, pharmacists, physiotherapists, etc. Another new role is the academic assessor. This is a university representative who will sign off your student's placement along with the practice assessor. The PAD, the practice assessment document, has been amended to reflect these changes. What is coaching? Coaching is a one-to-one conversation focused on the enhancement of learning and development of a daily goal, where the coach facilitates the learning of the coachee through questioning, active listening, and appropriate challenge in a supportive and encouraging climate. Why do we have coaching conversations? Coaching has been shown to benefit individuals through improved performance at work and career development. It also improves employee engagement, motivation and retention. Also, it improves organisational performance through the higher productivity of staff and prevention of costly problems. Coaching conversations. It's important that they build on relationships that are based on honesty, openness and trust. They enable the individual to be responsible for the results they are creating. Also maintains the focus on what the individual thinks and experiences. Coaching conversations can also help with the failing student. So how can your coaching conversation help both you and the failing student? A coaching conversation will help define the issue. Progress or otherwise can be easily monitored. And importantly, it is objective, not subjective. When done effectively, a coaching conversation can really help identify any issues early on in the student's placement and an action plan be put into place. What are the personal qualities of a coach? A coach needs to have self-awareness, inspire others, build on those positive relationships, is flexible, can communicate clearly, is forward-looking, manages professional boundaries, is a positive role model, and is able to give developmental feedback. How do you have a coaching conversation? It's really important to listen carefully, respond thoughtfully, and most importantly, resist imposing your own solutions. As mentioned in the previous slide, active listening is very important. The art of listening. Stop talking. Maintain eye contact. Have an open posture. Be attentive. Suspending judgment. Responding. Nodding, saying yes, but without interrupting. Make sure you're not steering. And remember, Are you listening or waiting to speak? Active listening. It's about summarising, getting clarity, the use of open and closed questioning. It's reflecting, probing, observing non-verbal behaviour, listening for feelings, showing interest, summarising. Skillful questioning is a very important part of a coaching conversation. As you can see, an open question is ones that start with what, how, where, why, when, who. These questions usually require a lengthy answer that involves someone's opinion. Opposingly, there are the closed questions. These questions usually only have one answer, either yes or no. Here is an example of a skillful questioning used within a coaching conversation. Right, so we've done that drugs round. Couple of questions. Have you heard of the drug digoxin?
Yes.
Have you ever administered it?
No.
Oh, okay. Do you know the side effects?
No.
Can you tell me what AF is?
No.
Did we get the right patient?
Well, I thought you checked them.
Do you have any questions?
No.
Right, so we've done that drugs round.
Yes.
Went really well. What do you know about the drug digoxin?
Oh, you give it to some cardiac patients.
Okay, yeah. Any particular kind of cardiac patient?
I think, haven't they got atrial fibrillation?
Yeah, that's good. Do you know what the signs and symptoms of AF are?
I think they get palpitations
Okay.
and sometimes chest pain.
Okay, yeah. So, what are the precautions that you should take before giving digoxin?
Oh, precautions to take before you give digoxin. Do you mean take their pulse?
Okay, so why would you take their pulse?
Because if their pulse is below a certain level, you don't give it.
Yeah. Do you happen to know what that pulse rate is when you wouldn't give it?
I think it might be 60 beats a minute.
Correct. So if it was below 60, what would you do about that?
I'd tell the nurse in charge.
Well done. Would you do anything else?
I wouldn't give her the medication. I'd write it on the drug chart.
What would you write on the drug chart?
The number that's the right number for when you don't give it for clinical reasons.
Great stuff. Any possible side effects that you're aware of the drug?
I think possibly it can slow the heart too much.
Okay. So if you think that's a maybe, how could you find out about it?
Oh, you've got the BNF on the bottom of the trolley. I could look at that.
Well done. The only other thing would be, how would you know you got the correct patient?
Oh, well, you check the name band. You ask them their name and their date of birth, and you check the name band for things like their name, their date of birth, their hospital number, and you check you've got the right drug chart.
Nice. Yes, I think you've done all of that really well. So, you got any questions for me?
No, thank you. I really enjoyed that.
Okay, so I've asked that we can meet up because there's been a bit of a problem. You've been late on a few occasions and it's kind of having an impact on the rest of the team, so I'd like to get to the bottom of it. Is there a reason you've been late on so many occasions?
No, there's nothing specific.
Tell me what the problem is.
There isn't a problem. No.
Is there anything I can do to support you?
Oh, no, not really. Yeah. Sorry.
I mean, is it like childcare issues? Can you get somebody to help you with childcare issues?
No, I can't.
Okay. Have you thought about setting your alarm, getting, a bit earlier every morning?
Well, it goes off early enough already. No.
Is there a way you can prepare in the evenings, to sort of give you a head start?
No, I don't have time to do that.
Are you aware of the impact that this has on the wider team?
Well, no.
Anyway, I'd like to monitor the situation over the next couple of weeks and see if there's an improvement.
Oh, okay.
Lovely. Hi, I've asked to kind of get together so we can have a bit of a chat. Bit of a problem with you being late on a few occasions. It's having an impact on the rest of the team. I'd like to get to the bottom of the problem.
Okay.
So what's causing you to be late on these occasions?
Well, I just can't really get myself going, to be honest, and before you know where you are, by the time everybody's had their breakfast, I'm already late.
So, why has there been sort of just recently? You've been doing fine, but...
Well, my mum, is in hospital at the moment. She broke her leg, and she usually looks after the kids for me.
Okay, so it's kind of childcare provision, is that what the issue might be? Is that out of sync somehow?
Yeah, probably.
Okay, so what do you think that you might be able to do that would get you here on time?
Well, I don't know really. Be more organised, I suppose.
What kind of support would you like from me?
Well, if I didn't have to do earlies, that would be a real help on a Friday.
Okay. You realise that might have an impact on the rest of the team?
I didn't really think about them.
Okay. I mean, I can have a look into it for you and we'll see what we can do. If I can sort that, could I have some kind of assurance from you that you won't be late?
Yeah, I really will try hard.
Trying's not really the answer that I wanted to hear. So what else could we do that would ensure that on the Fridays you can get here on time?
Well, I suppose I could ask my auntie if she wouldn't mind helping me out.
Lovely. Shall we monitor it over sort of the next couple of Fridays and see how it goes?
Okay, yes.
Lovely. If there's anything else in between time, you just let me know if there's anything we can do.
Oh, that's really kind. Thank you.
Okay, thanks. There are a number of coaching models. The one we tend to use here is the TGROW model. TGROW stands for topic, goal, reality, options, and way forward. So topic, tell me what you want to gain from today and how this fits in with your stage of training. Goal, what is your actual goal for this shift? Reality, what experience do you have related to this already? Options, what is available or happening today that will support you in achieving this goal? What options do we have? And way forward, what else could you have considered today? What do you think you would do differently next time? How can you further improve? GROW, G, goal setting. Goal setting, we're looking at goals being SMART. Specific, measurable, achievable, realistic, and timely. On the side of this slide are some questions you can ask in order to help achieve this. GROW, R, reality. What is the current situation? Questions you could ask. What is happening now? What is the effect or result of this? Have you already taken any steps towards your goal? How would you describe what you did? Where are you now in relation to your goal? On a scale of 1 to 10, where are you? What has contributed to your success so far? What progress have you made so far? What is working well right now? What is required of you? Grow. O. Options. What could you do to achieve your goals? Questions such as, what are your options? What do you think you need to do next? What could be your first step? What do you think you need to do to get a better result? What else could you do? Who else might be able to help? What would happen if you did nothing? Grow. W. Will or way forward. What will you do to achieve your goals? You could ask, how are you going to go about it? What do you think you need to do right now? Tell me how you're going to do that. How will you know when you have done it? Is there anything else you can do? On a scale of 1 to 10, what is the likelihood of your plan succeeding? What would make it a 10? What obstacles are getting in the way of success? What roadblocks do you expect or require planning? What resources can help you? Is there anything missing? What will one small step you take now? When are you going to start? Thank you for listening and watching this short presentation. We hope you have found this helpful.